Hi, I'm Talia Martin, and this is my neurovascular assessment weekly recording. So let's get started. So my first thing what I'll be doing is I'll obviously be carrying quite a lot of gear into my scene. I've been called to my patient, which is Gareth today, and I'll have my partner with me. So the first thing that I'm going to be doing is checking my scene and safety to make sure that there's nothing obstructing me from getting to the patient, or if there's anything that is going to cause harm towards me and my partner. The next thing I'll be doing is putting on my PPE precautions. So that could be either a gown, gloves, or a mask, depending on the situation that I'm in. Okay, so the next thing I'll be doing is gaining consent, which is a really important step. So hi Gareth, how's it going? I'm Talia Martin here. I'm going to be doing just to make sure everything's okay neurologically and just doing a couple of tests just to make sure everything's all good.
All good.
Alrighty. So I've gained consent, which is the first big step. Then we're on to the next one. So the next thing that is important is to go through my AVPU, which is, so Gareth is, hi, how's it going, buddy? How you
Yeah,
going
I'm good.
today?
Yeah.
So he's awake and he's alert. My patient is awake and alert. That's the A. So V, he's responding to verbal stimulation as well. So I've just spoken to him, which is good. Pain. So he's responding to pain. His face is sort of reminiscing, and U is for unresponsive. My patient isn't unconscious, so that's nothing that we need to worry about. The next thing that I'll be doing is my fast exam to make sure that he's not experiencing a stroke. So the first thing that I'll be doing is, can you please smile for me, Gareth? Yeah, okay, good. And can you lift your arms up for me like this? So his arms, he can lift his arms up and he can keep them up. When he smiles, it's not sort of like struggling to smile, like he can actually properly smile. There's no facial weakness there. And can you please say, hi, my name's Gareth and I'm from South Africa.
Hi, my name's Gareth and I'm from South Africa.
So he has the ability to speak. So that's the and T for time, so time of onset. So when did these symptoms started or occur? And it can also mean to poke the tongue. So can you poke your tongue out for me, Gareth? And it's not going to one side or the other, which is a plus. So the next thing that I'll be doing is if he doesn't have any symptoms of a stroke, so there's no facial weakness or weakness to one side, or there's any signs that he's had a stroke or is going through a stroke, the next thing that I'll be looking at is what are the other causes. So it's called my AEIOU tips. So the A is if my patient has had alcohol consumption or if there's any acidosis. E is for if he suffers from epilepsy or he has not enough electrolytes in his system. I, he could be causing infection, so he could have an infection in his system somewhere. Oxygen, O for oxygen or overdose, so he could have lack of oxygen in his blood system, or he could potentially have overdosed on a certain drug or anything like that. The U is for uremia, I hope I'm saying that right, which is a high level of waste product in the blood. T for trauma. Gareth, I can't see anything with trauma on my patient, which is good. There's no open wounds or anything like that, so that's a plus. The I, insulin. There could be he could have had too much insulin or too little of insulin. Gareth doesn't suffer from any type of insulin-dependent diabetes. P for poisoning. He could have a potential poisoning or ingested in some poison in his system. And S is for stroke or seizures. So the next thing that I would be doing if I had a blood sugar machine is I'll be testing Gareth's blood sugars, which should be between 4 to 8 as a normal blood sugar level. If it's too low of a blood sugar level from below 4, it could cause a hypoglycemia. And if it's above 8, they could have a hypoglycemia attack. So the next thing that's important to do a neurovascular assessment is the Glasgow Coma Scale. So as you can see, Gareth's eyes, he's simultaneously moving his eyes around and he gets a score of 4 for that. The next thing would be verbal. So, hi Gareth, can you tell me what day it is today?
It is Monday and
What's the month today?
It is May.
May. And what is our dog's name?
Harlow.
Okay, so he is verbally orientated and he knows like the time, place, and the month. So which is good. And he also knows he's not struggling to get these words out or anything like that. And it's not a big sort of struggle or anything, which is good. And the next thing would be the motor responses. So can you lift your left arm up? Yep, and then your right arm? Yep, perfect. So I can lift both arms up without any sort of struggle or anything like that. Sorry, I forgot to mention with how he was verbally orientated, that's a score of 5. And because he lifted his arms up both really well, it wasn't a struggle, that's a score of 6. So all up, that's a Glasgow Coma scale score of 15, which is a really good score. So my next thing I'll be testing is Gareth's pupil response with the lateral and medial. So Gareth, I'm just going to test your pupils just to make sure that they're dilating, okay?
Yep.
Could you look straight ahead for me? Okay, good. Yep. Looking straight ahead. Okay, good. So his pupil size went from 8 millimeters to 6 millimeters. So his reaction is brisk, which is active. It's not a sluggish or he doesn't have any at all, which is good. It's brisk. He also is responding, like his pupils are dilating just fine, and they're both exactly the same. It's not one's bigger than the other, which is good. So the next thing that I'll be doing is that I'll be explaining my procedures to Gareth, whether or not to transport him to hospital, to further testing, and make more further transport decisions depending on the outcome. So he's pretty good, he doesn't have many things, but with the AEIOU tips, it'd be good just to get extra testing just to make sure that there's nothing in his bloodstream or anything like that. And I'll be explaining, so Gareth, buddy, we're just going to take you to hospital just to run a few tests just to make sure everything's all good.
Yeah, no problem.
Okay, that's all good. Thank you for this week.